Okay, so welcome everybody to our presentation. This is our presentation about increasing the participation of Tyrolean women in breast cancer screening. You see here a map of Tyrol. And our project partner is also here today, TGKK, Tiroler Gebietskrankenkasse, who has, this health insurance has accompanied this program from 2007 onwards. And now we are proposing two main ideas how to increase the participation of Tyrolean women in this program. So breast cancer in the Austrian media, it is really a widely noticed topic, and there are many articles on this issue online, for example, here, Der Standard, Kurier, are also the news because it affects many women, of course. And for example, also Demi Moore supports the breast cancer awareness, and now I would like to open this. 1 second. With a TV commercial. This is on YouTube. I don't know if you can hear it now. It's very short. So this is.
I believe in a breast cancer-free world. While we're on this search for a cure, the hope is to eradicate this issue. It really has to start with the individual. We know our own bodies. Just take the time to pay attention to what it's telling you. I have an ability to affect the quality of my life, then I should.
So take one small step. Go to mylifetime.com to get informed and involved.
Join me with Lifetime to stop breast cancer for life.
Okay, so this is a celebrity who's very committed to this issue. And so our agenda for today is Diana is going to present the background analysis to this project, the vision, aims, objectives, also the current situation of breast cancer screening in Tyrol, and she's going to present strategical analyses like the problem tree, the stakeholder analysis, and the power mapping. And then first I will talk about a more traditional approach and still with innovative ideas to increase the participation of Tyrolean women in breast cancer screening. And then Vinod will come up with a rather revolutionary idea that we would also like to propose, although it may not be feasible in the end, but we would like to still propose it. And then finish with limitations, the conclusion, and the discussion also.
Hello. So I'm going to start with background analysis and the current situation and the program that I have already implemented in Tyrol, which is quite successful because we have already 60% of participation rates. So the project objectives are to increase the awareness without causing anxiety, and the main objective is to increase participation rates from 60% to 80% of a woman aged from 45 to 69. Also, we want to influence two target groups, 40 to 44 and 70 above, to increase their participation rates also for from 0 to 80%, which is quite a big deal. And we have a time frame for 1 year with a budget of only 50,000 euros. And overall objectives are to increase healthcare status of Tyrolean women, and by making them participate in breast cancer screening program, and which will influence in future the reduction of the healthcare expenditures. So breast cancer, as we all know, is one of the severe cancers that infected women all over the world. In Austria, around 5,000 women are contacted breast cancer per year, and 1,600 women are dying because of that. In Tyrol, the number is low. It's around, well, actually, comparing with the population, it's not that low. 430 women are contacting per year, and 115 of them are dying per year. So there are some literature that it's possible to reduce mortality rates by 15%. That's why EU in 2003 appealed member states to organize these breast cancer screening programs nationwide. And there are, of course, some advantages and disadvantages of breast cancer screening. One of them, the advantage, or the main advantage, that if the cancer is detected early, it's possible to cure it with 90% cases, so it's very high. But there are also some disadvantages like radioactive contamination and possibility to have a false positive diagnosis or a false negative diagnosis. And so in Tyrol, the program was already implemented from 2007 to 2011. It was, for the pilot phase was in Innsbruck and countryside, and it's around 40% Tyrolean women. And there were around 240,000 women being screened in total. So the program was quite successful, and it was qualified according to EU standards, and they reached already 60% of participation rate. So we have also some database. I don't want to focus on it because I already said about the target group. It's 40 to 69, and the place is in Tyrol, and they are getting some letters personally each year to be screened and to be informed. So there was a cause section analysis which shows that from 1988 to 2009, as a result of the breast cancer screening program, the rates of incidence were increased, and as a result, we have the decrease of mortality rates, especially in the elderly, of the old women. So we also consider problem 3 because it's very important to understand the problems that we're going to face, and one of them is lack of awareness, and that is the causes are lack of education and lack of promotion. So what we are doing actually, and lack of access because of the attitude and maybe their distance difficulties and time constraint because women are working and because they don't have so much time to go to a hospital to have this screening. And of course, the main problem is fear, because women are afraid to be detected. They are afraid of the pain, so we need to promote it in a very positive way, so they won't be that much afraid of it. And we also did some stakeholder analysis. According to their high power and their interest, we see a state government as with a high power but low interest part. Insurance company, Ministry of Health, social media, we see as the main key players whom we should inform. There are experts and doctors as well as social workers that should work with us within our campaign. And low interest, low power, there are women of the target group from 40 and above. And this is again the same with the more power and just another diagram of the same analysis. So Felix is going to now present the whole campaign.
Okay, so I present the first part of our proposal to actually our proposal how to raise the participation of Tyrolean women in breast cancer screening. And so first of all, we would like to introduce this logo in Tyrol, which has been used already all over the planet, the pink ribbon, and maybe also implement the slogan, a screening that can save your life, and it's in English now, but we would translate it then into German, or I would, and so have a nice slogan to it. This slogan we thought was broad and appealing also to women, that their life can be saved. And then we decided to implement this or to use the mother-daughter theme for the posters. The posters are a central advertisement, as we only have 50,000 euros, and so we would like to show mothers and daughters, on one poster. As to address the different target groups, one is younger and one is an elderly group. So we thought this would be intelligent to combine these two target groups with a mother-daughter theme, as they also have a close relationship, an intimate relationship, and so they can also inform each other about breast cancer and the screening. So we have here some proposals for the posters and what they might look like, and then have some a pink ribbon, the pink ribbon somewhere in the maybe lower left corner or something, and the slogan also on the posters. And we would like to introduce one central month in which we would like to bundle all the activities of our campaign, because we only have 50,000 euros. We want to spend them as effectively as possible. So we chose April, the month of April, to declare this month as the month of breast cancer screening. So in this month we would like to distribute all the leaflets, and we would like to hang up posters at gynecologists' practices, and also we would like to use Facebook in order to promote the campaign by, on the one hand, through advertisements on the one hand. I think this is quite easy to buy advertisements on Facebook for this campaign, and also have an info page on Facebook which informs about this, the entire dimension of this campaign, and contains all the information relevant for the women. And this is also cheap to implement. And also, we would like to do 9 breast cancer health fairs across Tyrol. So Tyrol has 9 districts, and we would like to conduct 9 health fairs in the biggest cities in the 9 districts. I'm coming to that later. And also, we would like to do a walk marathon in Innsbruck, which does not cost a lot, but raises awareness also in the media, which then can report on that, and also reach women in remote villages in Tyrol, like this. And then, we would like to do one central press conference in which we propose the entire concept. So just to bundle it in April also because it's the weather is warm in this month, and it's a nicer atmosphere for the women. Then in maybe November, where they are not as receptive to these messages, we think, go to the breast cancer screening, which might be more sincere. And in April, due to the weather, maybe also it's nicer for the women, and also not so many people are on vacation in April, and so we thought it would be sensible to pick this month. And so, as I said, our only advertisement is the posters and leaflets. And the 9 districts are those here, and there are specialized agencies that deal with this type of advertisement with posters, like where to hang them up, like in bus stations or also in screens on buses and in other public places. And so the implementation is easy, and it's still extensive. And so we would like to do the healthcare fairs in these 9 cities. Those are the 9 biggest cities of all the 9 Tyrolean districts, as you can see them here. Yeah. And these breast cancer health fairs are, there's supposed to be a workshop associated with the health fair, also leaflets which will be distributed during the health fair, and also some entertainment factor we consider important, like local, maybe female also musicians due to the breast cancer theme, or performance artists, and we have stalls there at the health fair, and also to hand out cosmetics. For example, Estée Lauder is very active in breast cancer awareness. They have this company has a fund for breast cancer awareness. Also, fitness products, spas, wellness stuff. We would like to give away, maybe establish cooperation with one of these companies so we can get a discount, like from Estée Lauder, for example. Then the walk marathon in Innsbruck, also in April, as I said, in this month in which we would like to do all our activities. And maybe it is possible for us to convince the mayor of Innsbruck, Ms. Opitz-Plörer, to participate in this walk and to also raise awareness like that, and then to deliver and convey the message to the women in Tyrol to participate in the breast cancer screening program. We would like to distribute T-shirts and also refreshments, of course. And so we hope we reach a widespread media coverage like this, also, as I said, in rural or remote regions of Tyrol. The budget plan for this is, as I said, it's only 50,000 euros, and so we concentrate most of our money and capital on the healthcare fairs, on the 9 fairs across Tyrol, and the rest, is distributed almost equally. Yes, and now I hand over to Vinod.
When you counter a prevention program, like when you take up a campaign or something, it's very important to take into consideration the barriers, which Diana already explained, like education barriers, fear, misconceptions or something. But in our case, in Tyrol already it has a very healthy participation rate of 60%, one of the best rates in Europe. So in this, to increase it to further 20%, that is to refine it better, the structural barrier is one of the most important barriers that comes here. So we thought the introduction of mobile digital mammography would be useful. This is not a new concept, means it's new to Austria and Midland Europe, but it's being widely used in America, Asia, even in the UK. For example, NHS has deployed it for the past 10 to 15 years. Each community hospital have 3 to 4 units deployed. They pass all the regulations. There are digital mammography units installed. It's perfectly safe. So these are ways to tackle, because it really goes to the nooks and corners of the region, like the small secluded villages. Because people, you can tell information to people, but to make them come is quite difficult. So we were thinking to take the healthcare to the people. In that way, we could really show the increased percentage of participation rates, which is our objective. And so the evaluation methods, we thought instead of handing out an individual questionnaire which people would most probably not fill out and hand in, we thought to include 2 or 3 questions in the fill-in form for the screening. Like for example, when you come to a screening, you would be asked to enter your name, data, and just your address or something. So we thought to include 2 or 3 questions. An example question would be something like this, with a link-art style answering mode, like do you find the ongoing breast cancer campaign informative or motivative enough? So these are the 4 options. So we would try to evaluate with this. This one is for the evaluation of the promotion activities as such, and you can evaluate the numbers by merely by the number of women that have registered or not. So,
but however, there are limitations to this, unfortunately, and quite substantial ones, because I talked on the phone to a staff member of the Austrian Association of Imaging Diagnostics, and she said that there is the Austrian law on radiation actually prohibits this, because every time such a mobile unit is moved, you need an acceptance test, that everything is safe every time it is moved. So this is quite impractical in practice. And also a limitation of breast cancer screening in general is that women do not necessarily live longer only because they attend such a screening. Maybe only the time is prolonged in which they know of such a breast cancer. For example, if a woman is diagnosed with breast cancer at the age of 62 and dies at 65, for example, she has 3 years of pain and all that. But if a woman is diagnosed at 58, for example, she has 4 more years of trouble and and running around getting chemotherapies and all that. So it can also cause additional years of pain. On the other hand, if, for example, such a breast cancer is detected at 55, the woman can be cured, could be cured, and could live to 80, for example. So this is the other side. And also the limitation of this project is that a plus 20% increase in the participation is quite ambitious, and it's hard to realize this and to achieve this, and that's why we also propose this innovative idea with the mobile units, although it's not really maybe practicable in Austria yet, but maybe this way in this direction needs to be gone in order to really achieve such a high participation of the women, and also to reach the women in the remote and rural areas of Tyrol. And the conclusion?
So to conclude with all these traditional methods we are already using, no, they're good, and of course we support it because we propose them. Maybe you can achieve a 3 to 5% increase, but that's always a maybe factor. But if you really need to show the potential of increase, we must innovate new ideas, like bring in the mobile unit or something to reach the thing, because we came across some studies which were done in America also, where two groups took part in the trial group. One group was given education without having a mobile unit nearby. The other group were given the same healthcare education information, and they had access to a mobile unit. And after 3 months, and the group with the mobile unit facility showed increased numbers of participation. So, and the goal must be to concentrate on the target, the yet to be reached 20%. So we conclude with that. And thanks for your attention. We thought of proposing these discussion questions like given the objective of this project to increase the participation of the women in Tyrol for breast cancer screening, do you think that it's necessary for the Austrian authorities to launch a different or a revolutionary concept such as the presented mobile mammography screening units one? Do you think they need to consider other options also? The second one is the increase in the participation of Tyrolean women in the breast cancer screening from 60% baseline realistic? And what do you think are the influence factors for that?